Whether people are looking to freeze embryos or eggs or undergo in vitro fertilization, IVF, the price for each of those treatments can range from $10,000 to $30,000. And for some hopeful parents, they just don't have that cash and their health insurance doesn't cover it.
I love how big his hands are on her.
Jessica McCabe was 39 when she was working on her book. The ADHD advocate, speaker, and YouTube personality was also trying to focus on her future family with partner Rafael Bogamazzo.
By the time I started IVF, my odds just weren't as good as if I'd been able to start it sooner.
There's so many factors involved and so many variables, so many things that could go wrong, health-related, physically, financially, age. There's so many things.
But like many dealing with infertility, the options out there are costly.
I knew about egg freezing in my 20s, but I just couldn't afford it. I knew it would have been a good idea, but I couldn't, It's another area where if it had been covered by insurance, the story would have been a little bit different.
Jessica's among more than 200,000 Washingtonians who have a form of infertility disease. According to the CDC, 1 in 5 married women ages 15 to 49 with no prior births are unable to get pregnant after 1 year of trying. And that only accounts for women. Men also face infertility.
It's my role to help them begin to think about different treatment options so that they don't feel like they're in control.
Dr. Kat Lynn, the medical director for Reproductive Medicine Associates, leads a fertility center and an IVF lab in Seattle, and now another location in Bellevue. Both clinics have insurance-covered treatment options.
Think about a treatment that actually has both the ability to treat a disease condition and the ability to prevent that disease condition in the future. IVF is a perfect tool for that.
When we looked at how much it would cost to do another round and how much it would cost to do donor eggs, if that's what we ended up needing to do, we realized we couldn't afford both.
Jessica and Rafael selected an egg donor to grow their family.
Now in retrospect, it doesn't matter at all. I love her so much. She is my baby. But there are still some times that it's hard that I didn't have that choice.
We so often have this idea that family is 2 parents and a genetically related child. But their family really is what we make of it.
More than 20 states plus Washington, D.C. have passed fertility insurance coverage laws. Washington State is not one of them. At the county level, King County has provided its employees infertility insurance coverage for more than 2 decades, including IVF.
So far, we were just looking at the states where infertility insurance laws are currently in place across the country. Are there any efforts here to pass a bill in Washington to cover infertility?
Yeah, Mimi, there is. So State Representative Monica Stonier introduced a bill last legislative session, but it failed. I reached out to her office and she said she's working on a new bill for the next session. She said it's already gaining bipartisan support. And Stonier said, quote, she believes the state may be better equipped to fund it in a form consistent with best practices this time around. Live in Bellevue, Farah Jadrin, King 5.